So EXSCEL was the cardiovascular outcomes trial for the once-weekly formulation of exenatide, a GLP-1 receptor agonist. So the trial read out now coming up on a couple years ago, showing a trend but not a statistically significant improvement in major cardiovascular events. So the poster we're presenting here at this meeting is looking at the subset of subjects in EXSCEL that picked up an SGLT2 inhibitor during the course of the trial. So patients still saw the regular doctor and were allowed to add additional medicines to control their diabetes. So the question we had here was, we know some of the GLP-1 receptor agonists have a benefit on cardiovascular outcomes. We know SGLT2 inhibitors have cardiorenal benefits. So what happens when patients take both classes? Do they get additional benefit, or do you kind of max out with one or the other? So there are reasons to hope there would be additional benefit because the mechanisms of action are quite different and the exact endpoints you see improvement on are different. So we took that subset of subjects in EXSCEL that took both a GLP-1 receptor agonist, exenatide, and an SGLT2 inhibitor, and compared those to subjects that took just exenatide but not an SGLT2 inhibitor, or people that took placebo and no SGLT2 inhibitor. So to do this, we used propensity matching, which is a method that you use for observational research. So we took an observational technique and applied that to clinical trial data, since we had open label, non-randomized SGLT2 inhibitor use. And when we did this and looked at those subjects taking the combination, the results suggest a trend for benefit on MACE and a potentially really interesting decrease, particularly in cardiovascular death and all-cause mortality in these patients that took both. So it's important to keep in mind with this sort of analysis that it's very much hypothesis generating, it's not confirmatory. So we hope that this will be some motivation for additional studies in more populations with different methods in the future to really dig in and see if these results we see replicate and may be a real benefit for patients. But our cohorts here, we want to keep in mind they're moderately sized. And it's a mixture of patients that took the two drugs at the same time and patients that took exenatide and stopped and then picked up an SGLT2 inhibitor, so either in parallel or in sequence. And there's always the possibility, we do our best to match the subjects so we can do a fair comparison, but there's always the possibility for other differences in the group. So it's really important to keep in mind that the results are directional. So these trends we see for benefit on particularly mortality are really exciting hypothesis generating data. But we'll need more work in the future to dig into those and really flesh out the potential benefit better.